We live in interesting times. For the headlines. California's 40 million people are under lockdown in the most drastic quarantine efforts by a U.S. state to contain the fast-spreading coronavirus. And we get to talk to our EBC correspondents from around the world and learn the latest developments around the coronavirus epidemic. I'm Alma Angeles, wherever you're watching from around the world. Thank you very much for joining us, and now to the news. Governor Gavin Newsom ordered all residents of California to stay at home in a bid to battle the coronavirus pandemic in the most populous state in the United States. The statewide order is the most dramatic containment measure yet by a U.S. state. Take a look.
There's a mutuality and there's a recognition of our interdependence that requires of this moment that we direct a statewide order for people to stay at home. That directive goes into force and effect this evening, and we are confident that the people of the state of California will abide by it. They'll do the right thing. They'll meet this moment. They'll step up, as they have over the course of the last number of weeks, to protect themselves, to protect their families, and to protect the broader community in this great state in the world that we reside in.
The statewide order, which Governor Gavin Newsom said goes into effect this evening, is the most dramatic containment measure yet by a U.S. state. No end date was set for the measure because the pandemic is a dynamic situation, he said. California is home to more than 39 million people and has been among the worst hit by the pandemic. It has experienced at least 18 deaths from the coronavirus, according to a Johns Hopkins tally. Now, Governor Newsom also said he did not expect law enforcement would be required to enforce the measure. Essential jobs and tasks such as grocery shopping would be exempt. In a letter to U.S. President Trump Wednesday requesting federal help, Newsom warned that cases were doubling every 4 hours in some parts of the state. To Iran now, a health official there said that every 10 minutes, one person dies from the coronavirus. Kianush Jahanpour tweeted, quote, "Based on our information, every 10 minutes, one person dies from the coronavirus and some 50 people become infected with the virus every hour in Iran." Now, these latest figures come as Iranians celebrate Nowruz, the Persian New Year, which ushers in a 2-week holiday during which Iran's roads are normally filled with people visiting family. The authorities had urged the public to avoid family visits or days out this year to stem the spread of the coronavirus. But footage aired by state television showed hundreds of vehicles pouring out of Tehran on Thursday evening. Iran said Friday that coronavirus has killed 149 more people in the Islamic Republic, raising the country's official death toll from the disease to 1,433. The number of people tested positive for the new coronavirus in Switzerland has risen to 3,028. We'll find out how the situation is in Zurich because our EBC correspondent, Ebi Ordinario, is joining us live from Zurich. Ebi?
Hi, Alma.
Hi, Ebi. What time is it there in Zurich right now?
Right now it's 2 p.m. in the afternoon, Paul.
Okay, can you tell us what is the latest over there in Zurich on the coronavirus?
Okay, so the latest situation on the coronavirus here in Zurich, Switzerland, or in Switzerland itself, we have about 4,176 confirmed now, and there are 43 who have died. The top priority right now for the Swiss Federal Council is, of course, the health of the public. The Federal Council has categorized the situation in Switzerland as extraordinary under the terms of the Epidemic Act. So right now they're trying to tighten existing measures and probably enact new measures affecting the public, organizations, and also institutions. For example, there's a ban on classroom teaching and all educational establishments. Big events and establishments with larger crowds are also prohibited. And people from high-risk countries and regions will be refused entry into Switzerland. So, which is also why you can, at the airport, you can see many planes that are parked and they're there for a few days already and they're not moving because so many bans to countries that the planes cannot fly to. But on a positive note, we're not on a lockdown yet. So people are still free to move around if they have to buy groceries or if they have to visit the doctor or get medicine. And yes, everything here is almost normal except for the economic side.
Oh, what about panic buying? Are you guys experiencing panic buying over there too?
Not very panicky, but we've noticed that people are also buying up toilet papers and sanitary napkins and even the hand sanitizer. So all those things to get everything clean, those things are being bought for. But food, everything is still there. The government has also reassured that there is no shortage, so there's no reason to panic. Everyone can just buy their normal daily needs, and they will make sure that everything will be refilled.
Closures, cancellations, postponements, these are, I think, the three words that are big today in the world. Are there any cancellations over there, postponements or closures? Schools, how is it over there?
Schools, yes, schools are closed, so my son is at home. Many are doing home office from now. Meetings are being canceled, big events, concerts that are supposed to be held are being postponed for now. Yes, but like I said, stores are still open. You can still get food and grocery. Restaurants are closed.
Oh, okay.
Yes, well, anything that will enable larger crowds to get together, those are the things that they're trying to close or make sure that people will not gather.
Are you guys practicing also social distancing as we guys here in the Philippines are?
Yes, so so I'm actually working at the office, and at my office, there's only one person with me right now. Everyone else is home office, so that's a very far distancing call, but.
So you're part of the skeletal force at the office then?
Yes, for the support.
How is it?
But everyone who's outside, they're being encouraged, yes, to make sure your hands are clean and you keep a certain distance. Here, others I heard is 1 meter, but here in Switzerland, they say 2 meters apart to be safe and not to be contaminated.
So I guess this is time for your family to be together more, right?
Yes, Paul.
You have more time, more quality time for each member of the family.
Yes, well, we're with them the whole day, and well, we have to find something for the kids to do because they'll get bored very quickly, and then
online games or movies.
We try to do something at home, games that you might want to do on the streets, like we did the hopscotch game on our floors. We just used the tape to mark the numbers and the squares, and then we played the hopscotch inside our apartment.
Okay, thank you so much, and you keep safe, Ebby.
Yes, Paul.
Thank you for your time.
So,
I know you're busy and you're going to be in a meeting in a while, right?
Yes, Paul.
Yes. Okay, thank you so much, Ebby Ordinario, reporting from Zurich, Switzerland.
So this is Ebby Ordinario reporting from Zurich, Switzerland. We live in interesting times.
Thank you, Ebby. Indeed, the number of positive cases in New Jersey is expected to climb as it opens its COVID-19 community-based testing site. And joining us live right now is El Aguilar. El?
Good morning, Alma.
Good
Our
morning.
exact location. Good morning. We are here in Bergen County, New Jersey. It is 9:12 in the morning, March 20. It's Friday morning. New Jersey cases have right now is 745 with 9 deaths, and it is expected to go up. New Jersey Governor Phil Murphy said operations at the new drive-through testing site starts today and will operate every day from 8 o'clock to 4 p.m. Although the testing site is established in partnership with FEMA, the testing site will be manned by the New Jersey Department of Health people, New Jersey State Police, and also the New Jersey National Guard. The drive-through testing site is expected to collect about 2,500 specimens every week, and it will give priority to those with symptoms of fever, coughing, and shortness of breath, particularly those people who work in the healthcare industry. The Department of Health continues to stress that whoever is feeling sick and need to get tested for COVID-19, they cannot just show up at the testing facility. They have to be referred by a doctor. A second drive-through center will soon be open this time in the central or southern part of New Jersey. Actually, next week, anytime next week, it will be open. On another note, the governor signed a bill stopping tenant and foreclosure evictions during this public health emergency. That's it for now from Bergen County. El Aguilar, Eagle News. We live in interesting times. Alma?
All right, Elle, can I just ask you, what do you think? What lesson can we take away from all from this crisis that is going on around the world?
Well, right now we hear whenever we talk to people, what we hear from them and what they always say is they would like to be closer to their families and loved ones because we don't know what tomorrow brings, especially in this time of crisis. So it's more of the thought of being with families because of fear that they hear stories, really heartbreaking stories, and all they could think of is their loved ones. So that's one thing. I think this brings us closer, family and friends. Even though there is fear and worry, you know that they are thinking of their loved ones. That's the main. I mean, most of them are talking about that. They, of course, the fear, but it's all about family.
Mm-hmm. What positive thing do you think can come out of this?
Well, from again, we always talk to people, and you hear different reactions saying, "Oh, good, I'm working half day only, then that means I can spend time with my children. I can do this. I can finally clear the clutter at home. I can finally clean the house or, do some painting and read book. The things that they neglected or ignored in the past because, life these days is not easy. They always work. We always work. I'm still at work. So that's one positive thing that we noticed. It's all about giving time now to those things that they've neglected in the past.
All right, thank you so much. Those are good words from you. Elle Aguilar reporting from New Jersey. Thank you, Elle, for your time. I know you're
Thank
working.
you. Thank you, Alma.
All right, joining us live now is from American Samoa. Here's Arian Torres. Arian?
Hi, Alma. Good evening to you there in the Philippines, and good morning here in Talofa in American Samoa. Today, I'm going to give two updates for two islands, American Samoa, is my location, and the independent state of Samoa. For independent state of Samoa, Samoa reports first suspected case of coronavirus, which the woman has been in the country since March 11 for a family occasion. According to the statement, she is being cared for separately from other patients and is currently stable. and sample has been sent to Australia for testing, and results should be available in 10 to 20 working days. And then because of that, there is emergency declaration already. A state of emergency has been declared in Samoa in response to the coronavirus COVID-19 global crisis. And this one will take effect 12 midnight Saturday, March 21st, 2020, Samoa local time. And here in American Samoa, I gave an update yesterday about the color-coded, which is blue, yellow, and red. And until now, American Samoa is under Code Blue, which means according to the new declaration of Governor Lolo Molinga, this one is minimal social disruption with an emphasis on social distancing, hygiene, and cough etiquette. And this one will take effect on Monday, March 23, 2020, American Samoa local time. And then, and once we get just one confirmation of any case of COVID-19, and then we'll move to code yellow. So as of now, we're still in a relaxed moment here in American Samoa. Alma?
You said there are two islands in American Samoa, the independent, what did you say earlier? Independent Samoa, American Samoa?
Yes, yes, American Samoa is the U.S. territory, and then the other one that is just like about 30 minutes by plane is the independent state of Samoa.
But it's one island, only different...
no,
is it one
they are
island
two
o talagang
different
separate?
islands.
Two different
Separate
islands.
islands sila. And
Okay.
then now they are the independent state of Samoa. They are not part of the U.S. territory, but then they are just like a family there. So it's just only 30 minutes away by plane. So kaya yung border talagang inaano nila
Binabantayan.
mayroong mga restriction when it comes to traveling to and from.
Okay, so you are in American Samoa, the U.S. state.
Yes.
Okay. So you are going to be in Code Blue? Code Blue ba sa
Code
Monday? Monday na?
Yes, Alma.
Okay. So
Sa Monday, yes. Magte-take effect siya sa Monday.
So Code Blue hindi naman hindi pa masyadong mahigpit, or is that very restrictive?
Hindi siya masyadong mahigpit. So ito lang yung mga parang pinaghahandaan yung mga preventive measures, like yung all businesses will only be allowed operate from 6 a.m. to 6 p.m. And then only private family gatherings of more than 10 people will be permitted. But there are exclusion with the schools here. Hinihintay pa for one confirmed case bago nila totally i-shut down yung school, or wait for the further announcement of the governor.
Oh, so hindi pa shut down ang school. Okay. So you're not in a lockdown yet. All right. Okay, that's good.
Pa siya.
Hindi pa. Okay, so are you guys getting ready or getting prepared just in case? Because I know we're hearing these stories and news from around the world. So what is American Samoa doing for preparation for this?
So ayun, continuous yung ginagawa ng Department of Health at saka ng mga government agencies dito para paalalahanan yung mga tao for precautionary measures like yung proper hygiene, kung ano yung social distancing, ganun pa rin. And then mahigpit na binabantayan dito ng hospital, including with the Department of Health, na yung mga may symptoms na kasi American Samoa is not part of the distribution list for the COVID-19 test kit. So lahat ng screening ay nanggagaling pa sa Hawaii. So pagka through flight, Hawaiian Airlines flight, kasi wala tayong pang-test dito sa American Samoa. So paano namin malalaman na meron na dito? Ang ginagawa ngayon, ang alternative ways na ginawa nila is mag-get ng mga samples tapos papadala sa Hawaii via telecommunication.
Wow, ang hirap pala, no? So you have to wait for Hawaii. So you really don't know, you're not really aware kung ilan na talaga yung meron.
Well,
Okay, so you just have
Yes.
to take care and pray,
Wala
no?
pa. Mhm. And kasi ang Hawaii is like about 2,300 miles away pa.
Oh my. How many
Bago
hours flight?
it's like about 5 to 6 hours flight by plane. Yes. Unlike naman kasi, pwede naman din sa New Zealand, which is like about, kakatch ka ng 2 planes, pero like about 3.5 hours lang. But then, it's a different, ano na siya, different country na siya. So, you have to get the visa as well. And right now, the situation nga, baka magsara yung border, we're still waiting for that. At, syempre, hindi natin madadala yung pasyente doon.
Oh my. Okay. So we will wait for your updates. We will be watching out for American Samoa. So Code Blue on Monday, and we'll see what's next. So we will be waiting for this developing story
Waiting for
from you.
the code, yes.
Yes.
Code yellow.
Code yellow.
Code yellow is the next one. So hopefully not. Yes.
Wag naman.
Hindi, wag.
Parang nagko-code yellow ka na because your background is yellow.
Yes.
No.
Yeah.
I
Thank you,
hope not.
Alma.
Let's pray not. Yeah,
Yes.
okay. Thank you.
Thank you, Alma. Okay, reporting from Pango in American Samoa, this is Arian Torres. We live in interesting time.
Thank you, Arian, for your time. Another day, another grim milestone. Italy's reported coronavirus death toll grew by 427 to more than 3,405. This is Thursday local time. This overtook China's numbers. Also, these people come to bless those suffering the most from the novel coronavirus, and then more and more often, the priests in Italy die themselves. The Diocese of Bergamo, northeast of Milan, appears to have been ravaged by the most by the stealth killer. At least 10 of its priests have already died of COVID-19. This is according to the Catholic daily Avvenire, and they reported this on Thursday. The deaths, whether of priests or members of the communities, are so numerous it is difficult to count, according to the newspaper. And we have more updates. Joining us live from Italy is our EBC correspondent, Jeremiah San Vicente Abad. Mia.
Hi, Alma. Good evening there in the Philippines, and good afternoon here in Rome. It's 2 in the afternoon. It's day 10 from the lockdown. It's Friday, March 20. And as of last night, the report is 33,190 positive cases, 3,405 deaths, and 4,440 reported recoveries. So as per the report last night, there are more recoveries than deaths. So it's something to look forward to, that patients are recovering. So it has been also declared that the schools are being closed not until April 3 anymore, but until May 2. Because the government has decided to be even more strict than the first declaration, the first guidelines that they have imposed. So now not only supermarkets and pharmacies and primary necessities establishments are opened, but they are to be closed at 6 p.m. And on Sundays, they are open until 3 p.m. So people are trying to help in slowing down this spread of the coronavirus here in Italy. I think little by little, people are also being more aware, and they are being more cooperative with the government. There are more police patrolling the streets. There is also a new form that has been released by the government where you can put your details. You have to specify why you're out on the streets. So it's either you're going to work, you're going for a medical visit, or you're going for groceries. But if you're going for groceries, for example, now they're more strict. You cannot go too far from where you live. So you also have to show your ID, and they verify where you are actually residing, where you are actually living. So if you are, for example, you're doing groceries too far from home, you're going to be reprimanded, and in the most extreme cases, you're going to be detained or you're going to pay a fine. So the government is really making more strict rules for the benefit of the citizens. Also, as Prime Minister Giuseppe Conte said, we are going to be separated now to be able to hug each other later on. But also, if there are lines to go to the supermarket, since there's this social distancing that is being followed here, there are also lines to donate blood to the hospitals. There are many more and more citizens that are also donating financially to be able to put up more spaces for the COVID patients, to be able to put up more bed space in the ICUs. And so in this 10th day of lockdown, also through social media, we can see that the Italian people are more united, and they are more cooperative with the government and with the police to be able to control the situation.
So, Mia, this is your 10th day of lockdown. At least you were able to go out and
Yes.
report. How does it feel to be in a lockdown? I know you're a
Well,
mom.
yes. So I
And
am 24/7 with my children, which is, it's also these days it's also fortunate because there are parents that are being separated by their children, especially the elder ones. So everybody on social media is saying, what is the first thing that you're going to do after this all ends? And most of the times the answer is, I'm going to hug my parents, I'm going to hug my friends, my relatives, and spend more time with them. So I have been, the last time that I've been out, it's, I think, more than a week. But the spirit right now really is to avoid any unnecessary trip outside, because the numbers here in Italy are very, very high. But I think we're also past that moment of panic where we're more rational, and more people are abiding by the rules and the guidelines set by the government.
all right, thank you very much, Mia. That is very good to know. At least no more panic buying. At least most people now
Yes,
are
because the
more rational.
government
Yeah.
is also, yes, they're also saying that there's no need to do panic buying because the groceries are not going to be closed. The supply of the material of the products is not going to be shut down. So no need for panic buying, but we are encouraged to do groceries once a week at least. That is the advice.
Okay.
So that you don't need to go out every day of the week or 3 times a week. You go once a week and you stock up what you need, and then that's it. If you have to go for a medical visit, you have to prove it, and work. You can work from home. Many companies are doing smart working, and so yeah, we are trying very hard to come out of this.
Okay. In some countries, they have taken measures for the elderly, like setting a time, like for example, this 2 hours, 6 to 8 or 6 to 7 or 6 to 8 maybe. This time will just be for the elderly who will go shopping. Is there like a measure or a rule there for this kind of a measure for the elderly to take care of them?
The elderly are encouraged actually to just stay home. And
Okay.
so if somebody needs to go out for groceries, whoever in your family can do it for you is encouraged to do it for you. Because of course, the reports are that elderly people are the most fragile, and they are the most exposed to the virus. So there are still elderly people going out, especially in the morning. They do it in the morning, but they are very prepared. Everybody here has a mask on. They have gloves. Everything. They are aware of the situation, but the government is advising whoever in the family can do the grocery for the elderly is better that they do it instead of the elderly going out for groceries or for anything for that matter, for to buy medicines. Yes, the elderly are advised to just stay home.
All right, thank you very much, Mia, and thank you for your time. I know you have to go inside now. I don't want you to get arrested. Thank you so much, Mia.
Thank you, Alma. So this is Mia San Vicente Abad reporting from Rome, Italy. We live in interesting times.
Thank you, Mia. And Eagle News, we'll be right back. Stay tuned.
When visiting the Philippines, Manila or Quezon City is a popular destination. But oftentimes the hustle and bustle of the city can be more stressful on your vacation. So when you feel the need to reconnect to nature or relax again, there's a beautiful oasis just outside of the city called the Garden at Ciudad de Victoria. Some of the species that you can see here include hydrangea, snapdragon, and stargazers. They're truly beautiful. The gardens at Ciudad de Victoria are so peaceful, tranquil, and beautiful that it's become a haven for young couples and a very popular venue for engagement photos. The next time you want an escape from the big city, the garden at Ciudad de Victoria is a wonderful place to visit.
Mula noon hanggang ngayon, gabay natin ang MTRCB ratings sa matalino at responsableng panonood. Sa tamang pagsunod sa MTRCB ratings, ginagawa nating ligtas at makabuluhan ang panonood ng bawat miyembro ng pamilyang Pilipino. Lumipas man ang panahon, hanggang may pamilyang Pilipino, andyan ang MTRCB.
Welcome back. Healthcare workers are on the front line of the coronavirus response. Let's talk to one of them. As a National Health Service, what is the impact of COVID-19 to your normal duties? That is my question. to Emmanuel Espirito. He is a nurse there in the United Kingdom. Hi, Noel. Good evening here. What time is it there?
Good evening po, It's about 3:30 po. 3:30 ng hapon.
Oh, okay. All right. So, Noel, how is it? You are in the front line of this crisis. Can you tell us how is it? Just tell us how is it to be working in such a situation?
We're a bit stretched po. We're a bit stretched kasi marami nagkakasakit na staff namin. So, ang nangyayari, we are extended yung mga shift namin, na-extend. Tapos, yung mga gamit namin, kulang, wala kaming masyadong PPE. May mga instances na yung ibang unit pumupunta sa amin, nanghihingi ng mask. Wala kami maibigay kasi kulang na.
Oh.
Marami kaming ina-admit na COVID-19 patients. Yung ITU namin puno na. We have 6 bays ang ITU. Puno na yon. Lahat ng pasyente is ventilated. Yung isang ward na katabi ng ITU, kinonvert na namin sa normal bay para lang ma-accommodate. And they are also admitting potential COVID patients po.
So, sabi mo, kulang kayo sa PPE.
Kulang kami in a sense na meron kaming protection pero yung ginagamit namin for our normal day, yung normal na apron lang, normal na gloves, normal na face mask na may face shield, hindi yung nakikita nyo sa mga report na balot yung mga health workers.
Like in China, yun talagang covered sila lahat, di ba?
Yeah, hindi ganun. Hindi ganun ang namin, ang ginagamit namin ngayon. Kasi kulang kami. Ang gumagamit lang noon yung talagang yung mga nasa emergency room, yung unang haharap sa mga pasyente na alam nila na COVID positive patient. Kasi sila yung exposed. So pagdating sa amin, pag inakit ng pasyente, ang ginagamit lang namin yung normal na lang. Kasi alam na namin na napaprotektahan na namin yung sarili namin.
Okay. So how do you protect yourself more kung ganun? Okay na ba yun, yung just a simple mask, yung parang ordinary, simple mask, gloves, what else?
Actually, may kami, bawat staff, bago kami umarap sa pasyenteng may COVID-19, may tinatawag kaming fit testing ng mask. So yung isang tao, meron ka lang allowed na specific na mask na gamitin. Hindi lahat ng mask pwede magamitin. So ini-issuehan kami nun.
Okay.
So yun, itatabi namin yun, hindi namin yun pwedeng ibigay. Hindi yun disposable. Kasi nga kulang kami. So yun ang ginagamit namin.
Okay. So how else? How else do you protect yourselves?
Just general, universal precaution, yun ang alam ng mga nurses yan, universal precaution. Naghuhugas kami lagi ng kamay. Kung ano yung film na yung mga surface malinis, mag-iingat lang.
I guess this is the first time that you were faced with such a situation, ano?
Yeah, talagang mahirap. Yung operating room namin, kasi ako nakabase ako sa operating room.
Okay.
Meron kaming 9 operating room. Bawat operating room meron kaming anesthetic room. So each room has an anesthetic machine. Iko-convert na namin yan para sa mga COVID patients. Magka-cancel na kami ng mga elective surgeries namin para yung anesthetic room at saka yung operating room, magamit namin yun sa mga ventilated na COVID-19 patient.
Toxic na toxic.
Yeah, talagang mahirap pero we're here to help. Kaya lang, ingat lang talaga.
So how do you keep yourself positive out of all this?
Ngiti na lang, making jokes, papatutog na lang kami ng kung ano-ano. Ganon. Pag nasa duty, biruan. Yeah, hindi na namin pinag-usapan na yung matatakot kami, baka magkaroon kami, hindi na ganon. Ano na lang, kumbaga, kung ano na lang we treat it as a normal day. Ganon na lang.
All right. Thank you so much, Noel, for that, for telling us what you're experiencing right now and still staying positive. Kahit na ganyan, ano? Salamat
Yeah.
sa iyo. Salamat.
Salamat, Alma.
Because you're in the front line. Thank you for helping us.
Salamat.
Okay, thank you, Noel Espirito, a nurse there in the United Kingdom. Joining us now is Graham Thomas. He is a care home owner for the elderly. Hello, Graham.
Hello there, how are you?
Hi, how are you? I'm good. How are you?
We're okay. We're keeping positive.
That's good. So what precautions are you taking to protect our elderly patients over there?
Well, mainly to protect the elderly residents that we've got here, we've had to look at how we maintain the environment in a safe place. And that's been really about ensuring that the visitors initially were safe to come inside. So initially, we were risk assessing every visitor that was coming into the care home, taking temperatures, and making sure that they weren't showing any of the symptoms or had not traveled to any of the places where they would be most at risk, first of all. And then a couple of days ago, the government here decided that we should restrict the amount of visitors coming into care homes here in the UK. So now we've had to close the home to all non-essential visitors altogether, which is really challenging for us in the care home because relatives are really important to those that are in the care home themselves. They rely on their visitors to keep them positive, to keep them in touch with the outside world. So this has been a real challenge for us here in the care home. So we've started looking at ways in which we can ensure that they maintain that contact via different forms of social media, through FaceTime, for example, or Skype. So these are the things that we're now starting to introduce into the care home, which also have their own challenges, because obviously we don't want people touching the same things as they go around the care home. So we're rising to the challenge.
So I know that the elderly are the most vulnerable as they, that's why we're taking care of them. Psychologically, how are they? How are they coping, and how are you taking care of them psychologically?
Okay, well, obviously with their normal family not being able to come into the home, we've looked at ways in which we can increase the social contact time with the staff that we have in the home. They are familiar to our staff. We're very lucky in our care homes that we don't use agency staff. So the staff that we have are familiar to the residents in the home. So by increasing that social time that the staff can have with the residents, means that their psychological welfare is being increased and being well looked after in the home itself.
The British government has been very cautious and changes daily. How have you been adapting to this?
Yeah, that's another really challenging thing for us here. Because it is changing, it's so quick in terms of the changes that are happening on an almost hour-to-hour basis. So a lot of my time is being sat in front of the computer, getting the emails coming in, and adapting how we're working with the different changes that are coming on inside. We're very lucky. We've got quite a bit of communication from central government, public health, the local government, and even our own regulatory authority, the Care Quality Commission, which is keeping us up to date. But a lot of those departments are now home working. They're not working in the central offices. So it does mean that we're getting a lot of additional telephone calls into the care home from different departments rather than it being centralized. So these are new challenges that we're going to have to deal with over the next coming weeks, I expect, as we make sure that we look after not only the elderly in the care home itself, but also making sure that we keep up to date with the changing legislation and impositions that are being put upon us.
All right. Thank you so much. Thank you for your input, Graham.
You're welcome. This is Graham Thomas from Bournemouth in the United Kingdom, and we live in interesting times.
All right. We now talk to a student, Annabelle Reynolds. Annabelle, how are you?
Hi, Alma. I'm doing good.
Okay. So you are a student there in the United Kingdom. As a student, how has this...
Yes, I am.
Yes, how has this affected your studies, and how are you keeping yourself busy?
It affects my studies because every aspect of my daily routine has changed. And since I'm a university student, I study a course in film, and I'm not able to film any projects until further notice. So the coursework will completely change, but the guidelines are still the same. And since I go to university in central London, I'm not able to travel through public transport as there's reduced of travel. So, but we should, as myself, we're not able to see our teachers. So therefore we should, they will provide online one-to-one conversations. And even though it hasn't been easy, and I know everybody's safety, and we should follow the quarantine rules and stay at home. And how I want myself to keep busy through this situation happening, I'll be doing my university work at home and online, and they also provided resources and links for the students to access for the meantime. And I also plan some of activities for myself to keep me busy, like I'm going to do some yoga, cleaning up the house, and watch a film, and so forth.
So there is something positive to that. What lesson can you take away from all this, do you think, as a student? How do you see this?
It's kind of a big challenge, and things will change, so we have to learn the new changes to this. Yeah.
All right. Thank you so much. And you keep yourself safe, Annabelle.
Thank you, Alma.
Thank you for your time. All right. We now go to, staying in the United Kingdom, we have Shelby Dostas, a virologist student in the United Kingdom too. Hello, Shelby.
Hello.
Hi,
I'm actually a global health student, but quite similar.
Oh, okay. Okay, so as a student, when they say, oh, so you're not a virologist, you're not?
No, so actually my course is global health and social medicine. It's quite a new course. It makes it, this current pandemic that's happening, it's quite relevant because sort of, you know, with the World Health Organization, we're sort of moving towards this idea of global health instead of public health.
So when they say pandemic, what does that mean? Again,
so,
let's educate me.
I'll try. I'm still learning.
Yes.
Quite a lot. So there's this big misconception between pandemic and an epidemic.
Okay.
So pandemic is when there's a disease originating from a certain region or country, and then it transcends national borders. So, for example, swine flu, if a lot of people remember that was declared a pandemic. But then we have epidemic, which is a disease that's confined within a country or a certain region. So if you remember Ebola, for example, in Africa.
Yeah.
So I think, COVID-19, it was declared a pandemic on March 11th of this year. And that was because obviously with increased globalization, so trade, traveling, you know, flights in London from going to Italy, like £20 one-way trip to return as well. So a lot of people are traveling more often now. So because there's more social interaction, there's a higher chance of pandemics to occur because different diseases are it's more easier for diseases to transmit across borders, which is why we're seeing a lot more pandemics. So the first pandemic was in 1918, the Spanish flu. I don't think anyone was alive from then. But so, during World War, so naturally it spread really quickly because there was no way to stop social interaction during the World War amongst the soldiers. And then the second pandemic, that was declared by the WHO was in 2009 with swine flu. And then now we're in the third pandemic that we're experiencing, COVID-19.
So how do you keep yourself positive out of all this?
I think it's quite hard because I like to read the news a lot. I have to read a lot of news for my course as well because it's about current events and different diseases around the world.
Yeah.
I try to maybe leave one day to not look at the news, and then the next day then look at the news, and then so forth. And also I think just making sure that you read the right sources, and there's a lot of people trying to, sadly, to make money out of things like this and trying to make, bogus news articles and such, but also to look at the bright side as well, For example, I know in the UK, a lot of restaurants, they're giving out free drinks to health workers.
Yes.
For example, just to try to uplift the spirit and, just looking at how everyone's sort of uniting now rather than having that sort of lone wolf mentality.
Thank you so much, Shelby. Thank you for your time.
Thank you. I'm Shelby. I report for me as a kingdom, and we live in interesting times.
All right, to Finland now, where the country has closed their schools. They've also declared a state of emergency over the coronavirus. Daycare centers are to stay open, but parents were asked to keep their kids home if possible. And we have more updates from our EBC correspondent there, Christina Somawang. Christina, how are you?
Hi, Alma. I'm good. How about you?
Good, very good. How are
Very
you?
well.
Yes, what is the situation over there now in Finland over the coronavirus situation over there?
Yeah, it's actually the third day since the Emergency Powers Act was in effect. And this is, of course, in regard to the pandemic coronavirus, or so-called COVID-19. On Monday, the Emergency Powers Act includes 19 clauses, and in summary are as follows. Nursery or play schools together with grades 1 to 3 are still open, but higher grades and universities are doing distance learning already. Nurseries are open for the essential people to be actually able to work. When we say essential people, these are the people working in healthcare, and also that includes the ones that are working in supermarkets, because it's one necessary things are people to have necessities po. And gatherings of more than 10 people are banned. The borders are closed since Wednesday, 18th of March, and Finns and residents of Finland are advised to come back as soon as possible. There is no traveling abroad for now, and people who can work at home are advised to work remotely. According to THL, the National Institute for Health and Welfare's website, so far approximately 400 laboratory confirmed cases caused by the novel coronavirus have been diagnosed in Finland. This figure is based on laboratory confirmed figures collected by the Finnish Institute for Health and Welfare by communicating directly with hospital districts. And Finns and permanent residents of Finland returning from abroad are advised to live in conditions that correspond to quarantine for a period of 2 weeks after their return to the country. I had an interview via Messenger with Miss Julie Alidem, a Filipino nurse here in Finland. She has a message to the public. To the public, Finland had been treating well our COVID-19 cases. As of now, we don't have any casualties. It's okay to stock food and necessities in our home, but we also have to think about others. Would there be something left for others to buy? Listen to the government. They wouldn't tell you to stay at home for no reason. The healthcare workers and other professions are mandated to be on field and to keep working. They are there outside doing their job to keep you and your family safe. So you can do your part by staying at home. Do not hoard. We need those masks and sanitizers you are stacking. By practicing hand washing and staying at home, there is no need for you to use surgical masks and hand sanitizers. And lastly, the President Sauli Niinisto on Friday urges the public to follow the restrictions and to those who defies it to come to their senses. Such bravery ends at the latest in a sick bed, according to President Sauli Niinisto. Alma?
Yes. Christina, I know I don't have much time, but I want to ask you what lesson and what positive thing can we get from this?
The positive thing about this is about taking care or keeping ourselves safe po, and nevertheless is thinking about others.
Okay. Thank you so much.
Think about others.
Yeah.
Yes.
Thinking about others too, yes. Taking care of them. And
Yes, Alma.
yes, thank you so much, Christina. I wish we had more time so I could talk to you more. But very,
Yes.
very informative. Thank you so much. And you do take care of yourself. And I know you just got married, right? Congratulations.
Thank you. Thank you. Thank you. Yes.
Congratulations.
If I may, I will do my I will do my extra with my new last name, I would
Oh,
say.
yes, please do.
This is Christina Sumawang Kinanan reporting from Finland Scandinavia Bureau. We live in interesting times.
Thank you, Christina. All right. All right, and that's the news for tonight. Join us online and here again tomorrow evening from all of us here at Eagle News. Thank you, and we'll see you soon. I'm Alma Angeles, and indeed, we live in interesting times.
Welcome to this program where you get the latest updates on the activities of the Iglesia Ni Cristo Church of Christ that have been held